faces of established patients, and there's a lot of great skin in the room. And so I would first of all like to introduce Addie. Addie is our cosmetic coordinator. She does all of our makeup and products at the office. We have a little skin store in our waiting room. And so Addie does consultations and puts makeup on our patients after we do procedures and just gives advice along the way. So tonight, our program is some tips for you for the skin. And this is what we do in our practice. We educate you, we give you some general advice from inside out. The second part is going to be showing you patients that do various things in our office. And we're really proud about healthy, beautiful, natural looks. The third part of the presentation, which I thought you might enjoy, is actually watching what we do with a real patient. So Donna readily volunteered and about 2 months ago came to the practice, and we are going to walk you through her skin journey. And so she comes to the practice, you'll see what she does, what we do, and then after we're done with the presentation, I'm actually going to inject her live, and then Addie's going to chat with you, put on her makeup, and give you some tips. So tonight's a lot of information, a lot of fun, and what we've done so that you can just relax and listen, some of the tips, we've just made a little handout for you. So we're going to recommend some vitamins and supplements, so you don't have to worry about that. You can just take it home. And there's also some little surprises from Skin Spectrum. We are offering everyone a complimentary consult with Addie at your leisure, a discount cosmetic consult with the physicians, and also we do a very special open house, and you will all receive an invitation to that. So we'll go ahead and get started. And so we're going to talk about Skin Spectrum. We've been in practice 25 years. I'm board certified in pediatrics and dermatology, and our passion is really global skincare, but it always starts from inside out. And so in our practice, we do things nationally and internationally. This year I was in Sweden. There's a new product that's being launched next year. We are the practice that helps the companies determine how to launch it and what to launch. Out of all the fillers in the United States, Voluma is the #1 filler, which we're going to use tonight. And our practice at Skin Spectrum does the #1 volume in the United States. The newest product that was launched in January, called Restylane Silk, our practice also does the #1 volume in the United States. So even though we're in this quiet little Tucson, Arizona, we really rock it, and we are on advisory boards and really have a national and international pulse on what's going on. So we're going to go ahead and get started with tips. Can everyone see the slide? See? Yes. All right. We put her on a nutritional program. She's lost 8 pounds, looks amazing, in addition to having less inflammation on her skin. So sleep well. Sleep is very important for all of us. And although you've heard it a million times, sleep is important. It recharges our body. Drinking water. In our practice, we encourage our staff, we care about them equally as much as our patients, to drink the old 8 ounces of water a day. Healthy food choices. We believe in a paleo, anti-inflammatory diet, which means proteins, fruits, and vegetables, and really eliminating processed carbs. We'll show you some patients and their before and afters. What happens just with dietary changes? And healthy food supplements. On our little handout for you, we have recommended some supplements that are antioxidants, anti-inflammatory, that we think are beneficial internally and also for the skin. Check your hormones. If you are 40 or above, we think it's a great idea to get your hormones checked. It's not always standard of care, but probably affects your aging rate. What that means is that it's got healthy ingredients, it has been tested, and it is accepted in the medical community. Fish oils, multivitamins, vitamin D3. We have all our patients wearing sunblock. You'll need a little vitamin D3 supplement. Coenzyme 10, alpha-lipoic acid, L-carnitine, and resveratrol, which is red wine if you guys were having any of that, and a mitochondrial restore kit. And these things are listed on you on a handout. Supplements. In our practice, what we do, there's something called phytofoods, or it sprouts, athletic greens. And this is a scoop in the morning. It's got probiotics, a lot of vitamins and minerals, and you can just drink it in your glass of water. Probiotics help colonize your gut. Oftentimes with food and inflammation, we lose some of our normal healthy bacteria and yeast. We like our patients on fish oils. It's a great hydrant for your skin. When people have dry skin and eczema, fish oils inside out really help, and we recommend about 1,000 milligrams a day. We do have our patients on vitamin D and antioxidants. So that's a little bit of the nutrition. So with exercise, it helps fat burning, muscle strength, bone density, and inflammation. Bone density is so important to the aging process. And exercise promotes balanced hormones, your human growth hormone release, and it decreases cortisol, your stress. So doing something, even if you're just walking, heavy impact exercise is actually not good for the skin. It breaks down collagen, but doing moderate exercise and good weight resistance. One of my colleagues talked to me about a 7-minute little interval training it's a free app. It's in the Wall Street Journal, and you can do the 7-minute exercises. It's about 30 seconds of just a nice core. You don't have to have an expensive gym membership to keep in shape. So nutritionally, we like the anti-inflammatory diet, so avoiding processed foods. So those are all the foods in the center of a grocery store. So if you think about the periphery of the grocery store, those are healthy foods. Natural foods, things that you can pick, eat, hunt, fish. Those are things that we call the caveman diet. And then we also, if you want to eat carbs, eat your healthy carbs, bright colored fruits and vegetables. So in our practice, we say no dairy, no gluten, no soy, and no peanuts. And that's what we had Joanna doing. And again, we'll show you some patients that have done this. So don't smoke, don't overeat, don't overbuy, and certainly don't suntan, sunburn. It's amazing the college students that are still going to tanning booths in Tucson, Arizona. It really accelerates your aging. And pray for great genetics, okay? So important. And I think that oftentimes, as we age, my patients will come in and it's just like, oh my gosh, I got my dad's neck. And all of a sudden they realize what might be coming down the pipe. So in our practice, everyone gets recommendations for their skincare, and we make it very simple. When patients come in, they either need to get fit or stay fit. And so getting fit means they might come in with photo damage, more wrinkles, and dullness to their skin, or acne or rosacea. Staying fit means that their skin's under better control, and they're doing things to stimulate collagen and gently exfoliate the skin. So we're all about prevention. And a great skincare program not only makes your skin look radiant, but it also reverses sun damage. And get a multitasking product. I love products. One of my favorite products is a sunblock moisturizer, and it has alpha lipoic acid in it. So it's something that exfoliates your skin. So for those of you who want a skinny program, you can get products that multitask. And products. We carry medical grade products in our office. Some things are prescription level, only physicians can carry, but they've also been tested, they've had studies done, because sometimes it's very confusing to say, well, this says it does this, and this says it does this. So sometimes in our practice, people just come in to get a guideline on what do I believe, I've read this blog, etc. And that's always great when you go to someone who has studied this, who is an expert in this. So prescription versus over-the-counter. Today there are many outstanding over-the-counter products. And again, we carry products in our office. There are many great products at the drugstore. And so sometimes you just need a little guidance. Sometimes a $7 product can be as good or better than a $200 product. The prescription products that are most commonly used in cosmetic dermatology are retin A and bleaching agents. And over-the-counter products, retinols. Neutrogena, Rock make great retinols. Some of the new studies show they work as well as prescription retin A's. Some bleaching agents are over-the-counter. Alpha-hydroxy acids, beta-hydroxy acids, antioxidants, and vitamin B. Hyaluronic acid is in almost every new product. It makes your products have a nice glide to them. They really hydrate the skin. So the newest things are growth factors in topical products, my personal favorite. Heparin sulfate is brand new this year, and this is a product that stimulates collagen and allows products to come through the skin. The only company that makes this right now is called Sente. We are just launching it this month, and they are really going to be something in the next few years that you see as an outstanding product line. Exfoliants, physically exfoliating your skin. We love Clarisonic Mia brushes or products that exfoliate. And then sunblocks. This year, big research came out that showed that having an antioxidant on your skin in the morning, like vitamin C, topically, or in a sunblock, will give you better protection against infrared. And when you live in Tucson and you're constantly getting sun, and you will break down your collagen. If you're lucky enough to have darker skin, which we see some beautiful dark skin in the room, you will have much more genetic protection. But if you have blue eyes or green eyes, you need as much additional help as you can. And even my patients who have more melanin, more color in their skin, every day they also need to wear sun protection. So in addition to topical products, we do lasers, we do light treatments, we do microneedling. I just taught microneedling in New York City at our academy meeting. We've been doing this for several years now. We're doing research with it. We also use lasers that basically can penetrate the skin and allow products to come in deeper when you're doing a procedure. Tonight, we'll do some fillers. Those are injectables, and they're products that we have in our own skin and joint spaces called hyaluronic acids. And you'll see immediate results. You'll see how it lifts the face and it helps the contour. And then neuromodulators are Botox and type products. So the newest things that we are seeing, everybody's talking about contouring. And one of the biggest things, and we do this a lot in our practice for the body, is cool sculpting. You can hook on a machine to your body. It actually is outside liposuction, freezes the fat, and over the next couple months the fat dissolves and goes away. A miracle, okay. And so we're doing a lot of body contouring, and next week we get the first in Arizona. They are making a little contouring device that's smaller for under the chin, brow fat, under the arm fat. So it has been the best technology for melting body fat. Kybella just came out in June. We are the only practice in Arizona to get it. We are a national training center. Kybella is a new product that you inject under the chin and melts the fat. It dissolves the fat, it's FDA approved, and 2 weeks after it launched in June, the company that makes Botox bought it. So you're going to hear a lot about that. We've been doing a lot, and I think we've trained 15 doctors to date, and they will be allowing other people to use this, but they're starting with a nice slow launch. Radio frequency, like microwave, radio waves, also can be performed on the skin, outside the skin, or directly underneath the skin. Something called ThermiRF. So our goal when we look at a patient is balanced, harmonious skin. You want your face, neck, chest, your arms to all look the same. You don't want to just focus on your face and then realize your neck looks like a Barbie doll attachment. The shape of the face, we don't know whether the true sign of beauty, some would argue, is symmetry when you look at someone. It's not perfect, but it's looking at someone who's symmetric, the shape of the face, and or the tone or texture. These are things, our brain is like a computer. When you look at someone, you look nose tip, and then you look at the whole face. So that we want to see this normal, harmonious look, normal muscle movement, not too little, not too much, and then volume. When we age, we lose bone density on our face, we lose subcutaneous fat, and our face drops. So we can now replace that, and what we try to do is, as someone ages, we make them look like they used to look. Also, we can create things. We can create a little fuller lip or cheekbones on some of our younger patients. So when you are out and you're thinking of where to go, a medical-based practice, we have certain bylaws. A physician, you should have safety protocols all in place. You have backup, and there are always going to be problems when you're having procedures done. 20% of my practice is taking care of problems and complications. Check the industry's website. If you're thinking about something, go on the website, see what physicians or practices they recommend. And we're called master injectors. And probably in our practice, I probably do the highest volume in the United States, if not the top few. So you want to go somewhere where someone has done a lot of injections and done a lot of procedures. If you're going somewhere and the staff looks weird, you should fear them. If the staff is looking healthy and great and natural, and really they don't look like they need a lot of makeup and very balanced, that is a great place to be. So when patients come in, we start with a medical assessment, a plan with goals. And some of our patients come in, our number one population are teachers and real estate agents. And some of our teachers have a small budget, and they come in, but they do something every year. I have some patients who have a rather large budget. It doesn't matter. Patients tell us this is our budget, these are our goals, and we make a plan that fits their lifestyle for work or events. We do a lot of people getting ready for class reunions or weddings, but then we make a plan. And I will tell you, we have won every class reunion, okay? Our patients are looking great. In 1/100th of a second is when you make your first impression. And unfortunately, it's not always what we're saying, but it's how you look. It's how your skin looks, how you appear. And looking your best never goes out of style. And when you look your best, you feel great. I love my job. All day long, patients come in, they love how they look, they feel confident, and they're so appreciative because no one knows what they've done, they just look rested and refreshed. And maintenance wins. It's like our car, it's like our house, it's exercise. Doing a little bit at a time is great. At 30 years of age, we stop producing collagen in our face, and we lose a teaspoon of volume every year. One syringe of product is a teaspoon. And education. We believe education for ourselves, for our staff, and for you as patients and customers, because we all are customers, is the most important decision that you'll make. You will make a better informed recommendation and follow a better plan. Beauty is math. And how would we say this? When patients come into our practice, we actually take calipers and we measure. And this is a Leonardo da Vinci finding, and it is devil in the details. The space between our eyes, the inside of our eyes, never changes as we age. It's the only thing on our entire face that doesn't drop or sag or move. And so what happens is, this is what helps us to define how people look. Miss Colgate is considered in Europe to be the most beautiful woman in Europe. And what they did is they took all kinds of women, they did surveys. And so what we do is we measure the space between the eyes. It should be exactly where the peak of the eyebrow is. And so when we make this measurement, the opposite side, and even though this is big, the opposite side of where this is should be the length of the nose, the length of the forehead, the peak of the cheekbones, the width of the lips, and the width of the chin, and the forehead. And so when someone has these perfect dimensions, it comes back to our brain as pleasing. And sometimes when we'll show you some before and afters, you'll think it's subtle, it's better, but it's pleasing to the eye. It's all about math. And this is something we teach and train. And so this is her two left sides, this is two right sides of her face. And still, she is darn good looking either side. But you'll notice how we are asymmetric. And she has more volume naturally on her left side. So she looks wider with two lefts, and she has a little narrower face and narrower nose on the right. And so this is a study where people look at these photos and they vote which person has the most pleasing face. 100% of observers picked 5 or 6 to be more pleasing. And when you look at this, there's something that comes back to your brain that says that is a more pleasing look. And this is what we do in our practice. We look at these photos and we might say, we can do some things to narrow the lower face or to raise the eyebrow or the arch. So again, it's all about math. And these are measurements that we use, and this is essentially what it boils down to. And so we have all sorts of formulas that help us. It is still our aesthetic eye and decision making that helps, but this is what is going on in our brain. So this is a young woman. She is an anchor woman in Denver. And we did this about a year ago, teaching a course up in Phoenix. And she comes in, And when you're looking at her, this is right before injections and this is immediately after. There's a little waffle in that screen there, so maybe throwing it off a little bit. But what happened is we put a little product in her nose to visually narrow it, a little product in her upper lip, and a little product on her cheekbones and in the arch of her eyebrow. Very subtle, not a lot of product, and this is immediately afterwards. And you can see on the profile, one of the other things that she has a little bit of a slope on her nose. We put the product in, and you'll see it more on profile. And you can see just a little bit more volume in her lip and a little more volume on the cheekbone. And you can see how with the fillers, we can make the nose straight, a little bit more lip show, and we keep things in a certain alignment. And these were photos taken by a professional photographer. But it is, when we would measure her, her nose is a little shorter for her face. So we created a little bit of a longer nose for her. And again, by putting product in her cheek, we create more of a defined lower jawline. So very quick, takes maybe 15 to 20 minutes for some things. Some injections take longer. So I'm going to walk you through Joanna's experience. So Joanna stands outside of our office and decides, should I come in? And she decides to come in. And this is our front desk with our very beautiful staff that greet her. And they're saying, hello, come on in. We pull her to the back room. Amy, one of my assistants, brings her back in. And we take photos. It's very important to document what you have done. We walk her back into our room. Amy intakes and takes notes during the evaluation. And Joanna's sitting down ready to go. Amy shows her a board where we educated her on various things that she thinks she might be interested in. I come in with my microscope and take a close look. We're always looking for skin cancers or medical things that are present. And we look really close. I've got my calipers, and we're doing measurements on Joanna to help make a plan. And Amy writes all of this down. So we show her some of our patients, and we make her make all kinds of movement. So you can see Joanna has a mole here. We hate moles, we don't like this mole. She's got some early changes around the mouth. We look at some of the shadows and some of the volume loss that she has on her skin. And one of the biggest things that Joanna has allowed us to share was her skin is genetically very nice, but just had a little bit of dullness to it. We see some photo damage and brown going on. And again, you can see the volume loss. Tonight, we're going to correct her nose. We're going to make her nose straight and her nose tip pop up just a little bit. And again, we're watching her muscle movement and how she elevates all these muscles. When you look at someone, it's a three-dimensional dynamic change. And then we put Joanna's photo up there, and we go over how it looks, what she sees as she looks at her skin three-dimensionally. And we take her subjective history, objectively what we see, we assess it, and we come up with a plan. So we put her on a topical program. It's a medical program, and we tell her to go off dairy, soy, gluten, and peanuts. We remove her moles. We talk about evening out her tone and texture with a light treatment. We talk about Botox for lowering some of the muscle movement in her face. We end up talking about fillers, which we'll do tonight to reflate and correct the volume. We do talk about her eyelid laxity. She has a little extra laxity. This would be something we actually do with a laser in our office. That would be something for her to consider. And then laxity under the chin with possibly our new product, Hybella. So what we do before today is we do the topical mole removal and IPL and the Botox. So we did 4 of the things over the last couple months. We reach out to patients in 2 weeks, assess how they're doing, how they're following their diet. Joanna might have gotten in a little bit of trouble on the diet part. And we answer questions, and then we decide the next step. So when Joanna comes in, this is her before. She's a little pink from the program, and actually might even look a little bit more tired because the program is stimulating her collagen. And what happens is, though, you're seeing the light reflection. Her skin is healthier. We're reversing some of the sun damage. So we decide we're going to take her down. We're going to laser off her moles. So this is me using the laser, and we're removing the moles. This is immediately after her mole removal. And you can see she looks like she has a couple bullet holes. It doesn't hurt. And after that, we do a laser procedure on top of her skin to help tone and texture. And again, there's a little discomfort, but on a scale of 1 to 10, Joanna, how much discomfort do you have? 4. And it's quick, it's easy. She's a little pink when she gets done. So as we follow her, this is 2 weeks out. This is the next week. She's still healing in, and her skin is a little bit pink. And you can see these are going to completely fade out. She has a little tiny pink left today. And so we repeat this little laser treatment for her. The IPL is for red and brown. The resurfacing texture is something that makes the skin red for a few hours, but really no downtime. And these 2 procedures complement each other for tone and texture. So as she is healing in, we are seeing the pink cool down and her skin tone nice and even. And then what we do is, when you're looking at the face, one of the things we talked about is we like a heart-shaped face. And we notice there is more volume on the lower face. And we notice that Joanna uses her forehead line. So we do some Botox on her upper forehead, around her eyes, and we do some Botox on her cheek muscle, which actually helps narrow the lower face. So what we do is, you can see already how the lower face is narrowed, because as you look at those other photos, she now has more of a heart-shaped face, her forehead lines are softer, and we are working on the contour of her face. And as you're watching her skin looks more uniform. As you look at her tonight, it's got a really beautiful glow. And Camille, we did a treatment on Camille last week for tone and texture. Her skin looks fantastic. She has some brown spots, no downtime, looks great tonight. And so this is what we see with just topical program, a little bit of Botox for narrowing the lower face, upper face, and some treatment for tone and texture. So you can see how her line on her forehead is softened, her eyebrows are in a more pleasing position, and that's kind of our first phase. So what happens is, we also talk about the body. So what we did with Joanna was to treat one of her arms only, and if we like her, we'll treat the other one. And you'll see tonight, you can take a look at her forearms, how one arm, the pigmentation is much, much easier. And then we would do fillers, talk about Hybella, and talk about her eyes. And then we would tell her a maintenance program, a little bit of fillers annually, stay in a great topical program. And as things age, you may want to do something that helps tighten the lower face a little bit more. So in our practice, we do a lot of combination procedures. And I'm going to go through several patients just to kind of show you all walks of life, men and women, all skin colors that we treat. And so I'd love Donna to stand up. Donna's here tonight, and you are welcome to look at her beautiful skin. And so Donna came in, and we had talked about having her do a deeper procedure, and she just did not want the downtime and the healing time. And she knew she had lost a lot of volume. She felt she looked tired, and so we ended up doing topical programs, some lighter laser treatments, and some beautiful fillers just to open up her eyes, get rid of the crunch, and have a reflated lip volume. So you can see how she has beautiful cheekbones, and this is probably a few months out. Donna has no makeup on here. If you look at her tonight, absolutely stunning. And one of the other things with Donna is she did not like her nose. She had a little bit of a bend in the nose. We were able to correct that with fillers on her nose. So it's really quite magical. This is a patient of ours, and she is just a few weeks out. We removed her upper eyelid tissue. She has rosacea and pigmentation, so she did some evening out of her skin. And we did some laser around her mouth, softened some of that downward turning, and we put her on an anti-inflammatory diet, especially with rosacea. She has lost 16 pounds, and you'll notice that part of that you'll see in the neck, part of it is treatment that just lifts and softens the face. She looks herself, but more refreshed. And this is a woman who was not happy with the peaking of her brow, shadows under her eyes, and a little rosacea. We did a little laser tissue removal, softened her brows so that she wasn't hyper lifting them up, and just a little bit of filler on her cheeks so that she has more volume on the upper face. And again, a very natural look, just very soft.
And this is a patient too, just comes in with a little feeling tired. We do just some upper face filler, more heart shape than rectangular. And you can just see how she's looking more rested. And does she still have laxity? Yes. But what she wanted was a fresh look. This is a patient of ours. She's in her mid-60s. And she started with us a year ago. She just did topical programs for about 8 months. She's 1 month out. We removed the fat pads under her eyes with laser, her eyelid tissue. We have not done any fillers, but she did laser. And she's one of our first Kybella patients. She's 2 months out from one treatment. And you can see how much fullness she's lost on her neck. And again, she has not lost any weight. This is right after treatment of it making an injection in the neck area. But you can just see how her eyes look refreshed. Could she have had surgery? You bet. But the growing trend in the United States are, number one, men wanting more treatment, but women do not want surgery. This is a patient who has rheumatoid arthritis in her early 60s. She's been on very strong meds, does not want to have any surgery, has to be on a blood thinner. And so we did laser on her eyes. We did the Kybella on her neck. She's not lost any weight at all. She's on prednisone chronically. And we will be doing a little bit of filler. But everyone thinks she's lost a lot of weight. And you can just see how we developed that with the new injectable. This is a patient also who we recommended maybe a deeper laser procedure. She needed to be back at work. And so what we did is her upper and lower eyes, and we did some fillers on her cheek, and we did a light treatment on her skin to even out her color. And she is getting ready to celebrate her 60th birthday. No one knows what she's done, but you can just see how her jawline's more defined only from putting product in her upper face. We know her, and again, looking under the eyes, just how much more rested this looks just from topical products. This is a patient who comes in and does not like her shadows under her eyes. We do laser for under the eyes. We have done some filler and changed the lip shape so she is not so downturned on her mouth. And again, she was a little bit more, which we commonly see, jaw forward, putting a little bit of product up on the upper cheeks. And this is something that we commonly do for all of our patients. And it just balances the face out. Our chin as we age goes up, our nose goes down. And this is a beautiful woman. She's come to our practice for maintenance, born and raised in Tucson. And we have just done fillers on her upper face. And she did a radio frequency treatment on her neck and jawline, just to tighten. And remember we talked about the ratios. We correct her lips so it's more of that 2/3 to 1 ratio on the lip. And doing the filler around the eyes softens the look. Her lips are more soft. And again, we have a little bit more defined jawline. And you can see from doing this radio frequency on the neck how her neck now has more definition and is tighter. We see this all the time. Women who have dark hair, dark eyes get melasma or a lot of pigment treatment on her skin. And sometimes from excess sun, you'll see loss of pigmentation and scarring. And again, you need to get the medical condition of acne under control. And then with this, we use bleaching agents, retin-A's, but she would need additional help. This is something that we commonly see. And this is a young woman who comes in with acne, pigmentation and melasma, and you can see how inflamed her skin is. She's really carrying a lot of extra fluid and puffiness on her face. She has not lost weight. This is all dietary change, where her chin is sharper, skincare program, and we do changes. Sun, hormones, and skin color make people prone to that. This is a young woman, again, very sun damaged on the skin. This is just a topical skincare program. And what we do is sometimes naturally she has a little pouting out that's excessive on her lower lip. You can just put a little filler near that and up on her cheek to balance out her features. This is a beautiful young woman, turns 40. She's a runner. She does not have a lot of subcutaneous fat. She has some melasma and volume loss. Skincare program, a little light treatment, and a little tiny filler under the eye area. This is a patient who everyone tells her she looks tired. And she says, I'm not tired, but I'm feeling tired. And so she does her topical program, and we do just a little filler to help get rid of that shadow under her eye and on her cheekbone. And this is a woman who has been out in the sun a lot. She plays golf, she's from the Southwest, and she just wants a freshening up but no surgery. And again, she just looks lifted. She just has a little laser and some fillers. And what we want to see is that skin bright and glowy. And healthy skin that glows almost looks shiny. This is a woman who came in with 3 rhinoplasties, nose surgery procedures. And she had peaking of her eyebrows, and in between the eyebrow area, deep creases. So we did some laser and some fillers. And if you look at her nose, we corrected that. She did not want to have surgery again, but did not like the profile of her nose. And with surgery, she had still some pigmentation and pulling. When you put fillers in, that helps soften this, but you can see now how her nose is a little bit straighter. This is a gentleman, he's a rancher. He comes in because his wife tells him to come in. This is 1 week later. We removed some of the brown growths on his forehead. We did a little filler under his eye and a simple peel. He was all healed. This is 1 week later. And he came in, and he is the nicest guy. He's this rancher. He's about 6'6", and he said, "I think I had a facelift." And no one knows anything. They all think he's lost weight. And sometimes just with peels, you'll get tightening on the neck. This is a patient. She's 70. She has great genetic skin, but just a lot of laxity on her lower face. So we do a little radio frequency in her lower face and Botox. She just didn't like how her skin was saggy. And so you'll just see that tighten up without having surgery. And again, the patients who come to us usually are not looking for surgery. This is a woman who's worked outside her whole life. This is just topical products and a chemical peel. And you can just see how it brightens and lifts the skin. And this is what she did. She came back the next year and did something else and just introduced herself to doing some good things on her skin. This is Sarah Fields. Sarah came in, she wanted us to just treat her rosacea. We said, no, you have to do your topical program and off dairy. Dairy really is pro-inflammatory. And so this is 2 weeks later, no laser treatment. She has gone on to lose 14 pounds. She's off her blood pressure medicines, her ankle swelling, and we ultimately treated her, but not until she is really medically stable. And you'll see the swelling, how it contributes to edema or swelling around her eye area. You can just see the neck improve. This is a young woman, no weight loss. This is 3 weeks after we started her on diet, skin care, and acne treatment. She joined a gym the same day she saw us. She never went, but everyone kept saying, "What gym do you go to?" But all of this is just diet. And this has been remarkable. I just presented these exact slides to a multi-surgical specialty conference. This is a college student. She comes in, she's got rosacea and acne program, but again, diet. And we did do some laser treatments to cool down her red and acne. Her acne was leading to scarring. If you intervene early, you can avoid the scarring. This is a physician in town. He told us we could use his photos. He came in because his mother, he's 50, told him to get his moles removed, which we did. And we gave him instructions on diet and programs and lasers. He did nothing. This is 1 year later. All he did was stop dairy and 50% less gluten. And he has not lost a pound. This is all just diet. And when you look at him, you swear he must have lost weight, and he said, "Everyone told me I did," but it is just the power of food in our life. And he has much less redness and inflammation on his skin. He did nothing, including no sunblock. Again, an acne patient, very inflamed. Just a nice topical program 2 weeks later. And this is a young woman who comes in, she ends up losing 15 pounds, gets on our topical program. She has got cystic scarring acne and just really needed to recalibrate her internal system. And we do treat this with standard care, but really changed her life. Very bad rosacea, deeper laser and diet. This is a patient who does not like her full neck, diet and upper cheek filler. And this is a cool sculpting result, which is very nice. They don't like their asymmetric fat pads. This is one treatment, this is our patient. But if you'll notice, we always change diets. When people are in an inflammatory state, they have acne and redness and eczema. And so you can see how not only their contour is better, but their skin is better. And again, these are patients just having a little refreshing on the skin. She has a lot of inflammation, and you can just see that central redness go away. You start to recognize when someone has so much inflammation inside their body, you see it on the skin. And she has some acne scarring, so she started a program to help soften that. This patient hates how her lower face is so heavy. It's genetic, and she has a very wide forehead. And so when you look at her, her valence is quite wide. And so what you've noticed is we've actually changed her shape of her face, have done fillers, and done light laser treatment programs. And so she loves how she looks, healthy skin, but just looks a little bit more refreshed. And we did her eyes also. And this is something over probably 18 months, 2 years. She's moving out of town. She doesn't like how red her face is, and she said, I am tired and I look tired. And all she wanted me to do was her lips, and I negotiated. I said, I'll do half lips if you let me do product on your upper cheeks. So we did some on her upper cheeks, which helped get rid of her shadows, and we did a little light treatment on her skin. And you can just see how the skin looks healthier. She doesn't look as tired. She's gotten rid of some of those hollows on her skin, getting rid of her moles, evening out her skin, and again, fillers. She went on to lose 100 pounds. He is 72 years old, and his wife is very sick. He wants to do some things on his skin, but no downtime. So he does some sculpture and fillers, and just some light treatment. He hates how knotty his chin looks, so just a little filler can soften some of the contours we have on our skin. He hated his neck simply by creating more of a significant jawline. He will redefine his face, and that buys him time. He still has the same laxity, but it's all a visual illusion. This is treating some of the pigment on the arms before and after, one arm. And again, we treat her eyes, her skin, just lifting the volume on her upper face. And she looks tired, she has more lower face dominance, more heart shape, she looks rested. And what we see as people are more confident, it changes their life, and it changes how people interact with them. When you look tired, it makes other people feel tired. And this is another patient getting ready to move. She hates how heavy her lower parentheses are. We just lasered her, softened her look. And it's about the contour. On her skin, she hates how heavy her eyes are. She ends up just getting some Botox to narrow her face, and if you'll notice her skin, it's uneven. You have to take care of the skin first. This is one of our staff, one of our first Kybella patients, and if you look at her profile, this is one treatment, and it's gone. It'll be gone long term, it won't come back. And today we looked at her again. She has significant evening out. So back to our project. And I'm going to go ahead, Joanna, and have you come up, and we're going to do some injections on you. Wow. And I'd like to introduce Tashina. Tashina has been my personal assistant for many years and is amazing, and also runs some of our lasers and spas. Thank you for coming. And so we can turn the lights up if you'd like. How are we doing? Okay.